I'm joined today by Dr. Ingrid van Beek, who's a chair of supervised injection session at the 9th edition of City Health Conference in October in Melbourne. Dr. Ingrid is a public health and addiction medicine physician who has been working at the sharp end of harm reduction for more than 30 years. So thank you very much, Ingrid, for talking to me.
Pleasure.
In a few months, Melbourne's first supervised injection center will celebrate its 1-year anniversary. So you were the medical director of Sydney's first medical supervised injection center, the first one in Australia. So what made you decide to enter the field of harm reduction?
Well, it was a bit of a case of being in the right place at the right time. Back in the early 80s, I was training at a hospital in inner Sydney, which was in the heart of the red light district, and also where there was a lot of injection drug use and also quite a significant gay population. So this is where the first cases of HIV were diagnosed. And I was already somebody that felt that it would be great to try to work in a field where I could make a real difference. I was very committed to social justice issues, so working in the HIV area was just a sort of natural fit for me. So I started working at a place for the very first day called Kirkton Road Centre, which was a very small clinic that was just set up at that time for marginalised populations, in particular at-risk young people, sex workers, and people who inject drugs. And with the aim of preventing, treating, and caring for HIV and other transmissible infections. And this is a service that grew over the years, became a highly integrated service with a needle syringe program, a methadone treatment program, and an outreach program. And so, yeah, I was very privileged to be the director of that program for almost 30 years until 2 years ago. And yeah, in the middle of that at that time, I was also then the medical director of our first injecting centre, also in the same area, King's Cross. So these two services very much complemented each other. And yeah, that was an amazing experience too.
So what interests me is, are there any differences in how people or policymakers react to the concept of supervised drug use now and compared to when we first started?
Well, definitely. When we first started, even though we were by far not the first, there were already some 60 or so operating elsewhere in Europe. But because we're the first in Australia, there was a lot of anxiety about what this would mean for the area, whether it would attract drug users, whether it would in fact make their drug use worse. So initially we were established as a trial. We were very rigorously evaluated. But yes, people in that local area were very supportive of the concept of an injecting centre, having in fact over the years said to us, look, we understand why we have a needle syringe program, but why don't you actually allow people to inject on the premises too? Makes sense. You guys are experienced professionals at this. If something goes wrong, you can do something about it instead of then just giving people needles and letting them walk out into the back streets of the area where, of course, they were at risk of overdose and other unsafe things. But of course, the law didn't allow that until 1999, when the law was changed to enable this centre to be established. So we had good support locally, but yes, more broadly, there was certainly a lot of anxiety, and the opinion had to be shifted through the evidence. But more recently, it could be argued that now it's really regarded as a very mainstream service. When there was debate about pill testing just a few months ago, many people supported this, and they used the example of the injecting centre primarily to justify this, saying, look, you know, that seemed scary and different to start with. It was new, innovative, but look how successful it was. We should be brave and also do pill testing. So I think, you know, it's a good news story.
Mhm. So, were there any other difficulties you faced during your work in Sydney?
Well, at first, certainly, as I say, people were, even in regard to the needle syringe program, that was a very new approach, back in the 80s. So there was a lot of anxiety. But yeah, people now are very broadly supportive of harm reduction here in Australia.
Mhm.
The surveys show that. But despite that, at the political level, it's not always so strong, and law and order, as long as drug use remains illegal. I think we always have that issue of that the health agenda gets trumped by the law and order agenda when it comes to illicit drugs.
Mhm.
So we still have to keep pushing here, and pill testing is a good example where there was a lot of, despite very high levels of community support, there was quite a lot of political pushback.
Mhm.
So we're still struggling to try to make the case there. But I think we are making some headway again. But
Mhm.
each initiative has to be sort of fought as they come.
So you mentioned pill testing. Where do you see harm reduction practices in the future in Australia?
Well, again, there is broad-based support. It has been, I think that this country does have a history of pragmatic, realistic approaches. It's been commented before that, we may be lucky that we were settled by convicts rather than Puritans,
Mhm.
as is the case in the US. But that said, I think also that the ice epidemic, as it's been described, the increased use of high-grade crystal methamphetamine, which has been associated with public order issues and for which we don't have necessarily great public health responses. I think that really has set us back a bit on the harm reduction side
Mhm.
of things. There's a view that we should just basically be forcing these people
Mhm.
into treatment or locking them up. So that certainly hasn't helped our
Mhm.
situation. So yeah, there's still challenges. And also, there are these sort of fundamentalist organizations that particularly target things like the Injecting Centre.
Mhm.
They see that as the sort of epitome of the harm reduction approach. And so they still target those types of initiatives, thinking if they can bring something like that down, then the rest will wither on the vine. So despite having a lot of evidence, we need to, keep on pushing for these types of initiatives at that political level to make sure that they keep up with what the local community actually thinks.
Yeah. So, Ingrid, you have participated in many CHI conferences, including the one in Odessa. So, what do you hope to get from the one in Melbourne?
Well, I'm hoping, obviously, the fact that it's here in Australia, that will give this conference more of an Australian flavour. And at the same time, because it is an international conference, so there will also be input from experiences throughout the rest of the world that will maybe give more of a perspective to local policy makers. So that, yes, I'm really hoping that we can have an influence on public policy making here at the local level with this conference.
Thank you very much for talking to me, and I hope to see you in Melbourne.
I look forward to that too. Thank you very much, Cassia.